Today we have an update on the current COVID-19. With us today is Mayor Sarah Karen.
Thank you, Jennifer. Today the City Council held a special meeting at noon and took 3 important actions to protect our community. First, an emergency resolution was passed declaring an emergency to address the threat of COVID-19. Second, an emergency ordinance was passed limiting food and beverage business to curbside and takeout operation, closing them for on-site consumption, closing recreational facilities, theaters, entertainment venues, arcades, bingo halls, bowling alleys, and the like. This does not apply to places that offer food for off-site consumption, room service in hotels, airports, or emergency facilities, and it also does not apply to any of our industrial businesses. And thirdly, the finance officer was authorized to write a special check in the amount of $150,000 toward a community rescue fund being set up to help those financially affected in our community by business slowdowns. Effective last night, all city and county buildings are closed to the public. City and county employees report to work and conduct business via telephone and electronic means, as well as by appointment. We know we can reduce the impact of this coronavirus outbreak by acting proactively and aggressively. I want to thank the community members who are cooperating in this effort and encourage everyone to do their part. If we self-regulate now, we will make a significant reduction in the risk and exposure to COVID-19. We can and we should change the way we behave. There are creative ways people can protect themselves and others. I call upon all citizens to use every resource available to your fullest ability and capacity to limit interaction. Do not enter a business which you can patronize electronically. Carry out your meal instead of dining in. Visit with your friends on the phone instead of getting together. Call for delivery instead of shopping in a store. Worship online instead of in your church's sanctuary. Exercise at home instead of at your club, if you can. At the City of Watertown, you can get a permit or pay a bill over the phone or via the internet. That's why we have closed City Hall to walk-ins and are servicing people over the phone and internet. If you have to come in person, you can do so by appointment. That's why we've closed the Wellness Center. Circumstances change quickly, so I urge everyone to take personal care to help practice responsible living and prepare for the future. Together, we will achieve our goal of slowing down community spread as much as possible to give healthcare professionals the upper hand with this terrible disease. As for Watertown, our community will continue to keep business going as much as possible for as long as practical in order to have the best outcome for all of us. Thank you.
Hello, my name is Shannon Britt. I'm the Infection Control Coordinator for Prairie Lakes Healthcare Systems. I know you've heard this information before, but we want to just reiterate of what to look for COVID-19. The symptoms range from mild symptoms to severe, and death has occurred in some cases. Fortunately for South Dakota, we have only had one of those. The symptoms may appear 2 to 14 days after you have been exposed. The symptoms are fever greater than 100.4 degrees, a cough, and/or shortness of breath. And those keeping in mind this time of year with allergy season, your cough or shortness of breath may be normal for you. So take into consideration what your normal symptoms are. And maybe it isn't COVID, but if you're concerned, contact your provider. Things that we ask that you do if you start developing symptoms is to stay home. As Mayor Karen said, social distancing. It's hard we're social people. We'd like to be with our friends and family, but at this time, a phone call is our best way to communicate with each other. Remember to monitor your symptoms. If your symptoms become worse, please contact your provider. Call your primary care physician. Be sure to share with them your symptoms before going to your physician or to the emergency department. That way they're able to prepare for your arrival to help prevent the spread of COVID-19 in our community. And then follow the directions of your provider and other public health officials. How is COVID-19 spread? The virus is thought to be spread mainly from person to person, between people who are in close contact with one another, about 6 feet. Again, that's why we're asking for social distancing of 6 to 8 feet. It is thought to be spread through respiratory droplets produced when the infected person coughs or sneezes. These droplets then land in the mouth and noses of other people nearby that could possibly inhale to the lungs, therefore causing the potential for you to get COVID. Can people spread the virus without being sick? Most people are thought to be the most contagious when they have the symptoms. Some spread might be possible before people show symptoms. There have been some reports of this occurring with this new coronavirus, but this is not thought to be the main way of spread. It is thought when they're most contagious when people are symptomatic. I've been asked several times, can this be spread on contact with contaminated surfaces or objects? That may be possible by touching surfaces that have the virus on it and then touching your own mouth, eyes, or nose. But again, this is not thought to be the main way COVID is spread. COVID is being tested in Cottington County where available, but testing is limited. Cottington County facilities will prioritize testing aligned with guidance from the South Dakota Department of Health, which at this time includes hospitalized patients, healthcare providers, and people in communal settings, such as long-term care facilities and assisted living centers. Again, these people need to have the symptoms also. If your symptoms are mild and you're hoping to be tested, please understand that a test may not be ordered, as tests are being preserved at both the state levels and also commercial levels. And they're being preserved for those that are sickest and deemed highest risk. Testing individuals with mild symptoms may not be prioritized in otherwise healthy and well individuals, as healthcare providers can only treat the symptoms. Please work directly with your primary care provider regarding your care if you do have the symptoms of COVID. Recommended measures, to reiterate what you have already heard, but it's to stay home when you're sick. Please, especially if you have a fever, stay home. Wash your hands often with soap and water. Please do this correctly. Wash your hands for at least 20 seconds. And that's rubbing your hands with soap and water, soap for 20 seconds. That's the time it takes to sing happy birthday to yourself 2 times. After rinsing your hand, scrubbing your hands and all surfaces of your hands, rinse them under the water. Then take your towel, dry your hands, and then shut off the faucet. Because the faucet's contaminated, you want to use your towel to shut that off and not recontaminate your hands. Remember to wash your hands after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing into your hands. If you're unavailable to soap and water, use the alcohol-based hand sanitizer, and remember to rub your hands together over all surfaces until the hand sanitizer is completely absorbed. Again, we ask for social distancing. Limit close physical contact, including handshakes. Limit in-person gatherings. That means making phone calls just to discuss those little things to the person next door. Avoid crowds, especially in poorly ventilated spaces. Avoid touching your eyes, nose, and mouth. Cover your cough or sneeze with a tissue. Dispose of the tissue in the trash, and then wash your hands. Also, it's best to wash your cough or sneeze into the crook of your arm. Regular household cleaning spray or wipes can be used to clean and disinfect frequently touched items and surfaces. As for face masks, CDC and the South Dakota Department of Health do not recommend that people who are well wear a face mask. Face masks should be used by people who show symptoms of a harsh cough, shortness of breath, or fever to help from spreading the disease.
My name is Kerry Johnston, and I represent the Human Service Agency here in Watertown. This is a very anxiety-provoking time, and today I'm going to talk a little bit about what you can do to reduce your overall anxiety. First of all, I'm hoping that everyone can do what we call a reframe of thought. Instead of thinking, I am forced to stay at home, this is against my will, this is completely uncontrollable, and I'm scared to death, I'm hoping people can reframe it to say, I'm going to do my part. And my part entails staying home, washing my hands, keeping my family safe, and then working through the anxiety and issues that that presents. Secondly, I hope that everyone can just get what information they need on COVID and then shut the internet off. You don't need to know that people are still dying in Italy or that somebody else in New York has gotten diagnosed. What you need to know is what you can do for you and your family. We don't need to keep reading these horror stories. You just need to know what our elected officials are advising that we do. And right now that is just stay home. Next, I'm hoping that everybody will take care of their body physically. By doing that, we want you to get adequate sleep, try to eat balanced meals, keep yourself hydrated. If we deny our body the nutrients it needs and the sleep that it needs, we end up getting extra anxious at times. And so first start with that. Try to get at least outside to walk around some. Outside is not contaminating anybody if you just go for a walk and get fresh air. That was also good exercise for you as well. Try to stay busy and divert your attention away from some of the issues that make us more anxious. Read a book, plug into some Netflix movies like everybody is doing, or have conversations with friends via texting. Avoid alcohol and drugs. I know this is a time that challenges everybody's sobriety. If you're in sobriety, we ask you to reach out to online meetings. We are asking individuals to do the absolute opposite of what we want people to do when they are in recovery, and that's generally to meet and seek help and support from other people. We ask that you do that online, and I will be sharing links with the 2020 COVID site as well as the Human Service Agency site where you can look up what avenues you can take online to do that. You might try meditating or doing some yoga if you just can concentrate on that you are healthy today and you're going to stay healthy, and that we're going to do everything we can to keep everybody healthy by staying home and practicing great hygiene. And finally, know that HSA, although we're going to close our doors for face-to-face operation, we'll still be open via crisis line and appointments on phone. Clinicians are contacting their clients as we speak to arrange phone conversations and phone therapy sessions, whether we're using Zoom, telemedicine, or over the phone. So you're not alone. We're still here available to help you in the best way that we can. And finally, in talking with your children, they will reflect your anxiety. If you can be calm and let them know they're safe and okay, then they will feel safe and okay. So just practice what we want to preach to them, help them have a structure and a schedule by getting their homework done, let them go outside for a little while, but please don't let them go to hang with friends' houses or have sleepovers or that kind of thing. We just want them to be safe and secure too. Your anxiety will be reflected in their well-being too. Thank you.
Thank you. Thank you, Carrie, Shannon, and Mayor Sarah Karen for talking today. Are there any questions from members of the media?
Yeah, I'll start it. Do you need a mic or just go?
Go ahead, say the question and
I'll repeat it.
The question is, I've got actually two, one for the mayor, one for the hospital, Shannon. That deals with the hospital equipment, our medical people, how protected are they? Ventilators, masks, all that sort of thing.
Sure. So I'll repeat the first question if that's okay. Shannon, do you want to answer this? So this is in regards to protective equipment for our staff. Is that correct, David? Yeah.
Okay. We're very blessed here in Watertown. Our staff has been protected and well educated and have been following any precautions that needed. The recommendation is for N95 or PAPR respirator masks. Prairie Lakes has PAPR masks. We've had those for years. So the staff is instructed on how to wear those and take care of patients with those. We keep following guidelines, checking for recommendations if anything else has changed. If we've been notified of a patient that's coming in that might have COVID symptoms or suspect, we're asking that they're masked prior to arrival. The clinics have been great in sending patients over if they need to with masks, as well as we working with EMS to do the same. So we have masks in that case. There is concerns of shortages, and that is nationwide, and we're implementing proper use of PPE, personal protective equipment, our masks for our employees and for the patients that could be ill, but also using our resources in the best way that we can.
And respirators too? You okay?
Yeah, we're okay in respirators. What's nice about a PAPR unit is they're reusable. And so it's a big hood that blows cleaned air, and that goes through a system that they wear on their waist. And the staff is able to keep providing care to the patients, and then at the end of their shift, then they can wipe down the unit and then someone else can use it.
Can we expand beds if we needed to?
Yes, with what we've had there's a planning with the city, and the plan is in place for over 10 years of what we would happen in a surge capacity. So we have plans, as well as other entities in the community, as how we would surge if it would come to that. Fortunately, at this time, it looks like a lot of COVID patients are going to be able to stay at home and be treated, but we do have a surge capacity for those that would have to be hospitalized. We do have ventilators, and we have our backup plan, what we will do with those. We have what we normally have in our critical care unit, but we also have what we have in our operating rooms.
You have a second question?
Yeah, for the mayor, and then just to, if you could be a little bit precise about the dollars that were appropriated for emergencies, how it would be used, who would qualify, can you put any more light on that?
Sure. The question is about the dollars that the city is setting aside for emergency fund. The Watertown Development Company will be putting the guidelines together, and they're not done yet. We just wanted to be able to act quickly because some of the Small Business Association and the federal government things that are happening will take a lot of time. And so they're essentially looking for hardship created by business slowdown in our community, and we'll take them on a case-by-case basis. Watertown Development Company will administer the funds, and there'll be loans with zero interest is what we're thinking, so the money will be paid back eventually. But the term and how much, the dollar amount, and for what purpose exactly isn't yet determined. We just felt we need to support this effort, which started by community members and other businesses putting money into the fund, and we want to show that we're part of this as well.
Troy?
Mayor, can you address the action that was taken by the City Council this afternoon pertaining to local business? Can you just recover that?
Sure, he asked me to recover the action that was taken about local business. We did shut down some businesses that are considered non-essential and that they're just entertainment and something that we don't really have to do that involve congregating people. Because we don't want people to be coming together in groups at this time because that's how the virus is spread. So restaurants and bars can still provide takeout service, and I know there's some real creativity going on about takeout drinks and how that can be done legally, and so that people can still patronize the business in a different way. And I call upon everyone to use your creativity. We have a lot of that in this community. We don't want to shut down the business. We just want to stop the spread of the virus. And that happens when people come together in close proximity to one another. So that's the point.
And then one more question for me, probably for Shannon or Jennifer. The governor at press conference this morning said that 30% of South Dakotans could be affected by COVID-19, which is a large percentage. She said tens of thousands of people. Shannon, you spoke about having a surge. If that occurs in the Watertown area, are we prepared to deal with that from a medical standpoint? If it gets to the point where we are utilizing a lot of bed space, that sort of thing, what's the plan for that?
Okay, and Troy's asking if we have a surge of people, of how we'll be able to provide care for that. One thing, as Mayor's stated several times, and we've asked, is the social distancing. We're hoping instead of a spike of illness, we're going to see it spread out over a longer period of time. So we're asking you to stay home if you're sick, not be hanging out together. Even if it's just a couple people, we need to socially distance ourselves to prevent the spread. But there will be people that will become sick, and we do have a surge plan in place, and not only for Prairie Lakes, but our community is so great is that we've worked in so many different entities of what we will do. We have a lot of things that we just got to start up and say, this is what we're going to do. And we've got different facilities we'll be able to take care of patients still in the outpatient setting, the inpatient setting, still providing the great care that is offered in Watertown by all the medical providers, but being able to keep people safe from being exposed if they don't need to be.
Question for the mayor. Mayor, the schools are closed, county buildings are closed to the public, city buildings closed to the public, non-essential businesses are going to be closing in a couple of days. If things continue to get more serious, what would be next on the checklist in terms of action by the city to take? Is there more you can do?
He's asking what would be next. We have state, county, city offices all closed. Schools are closed. What do we do next if that doesn't work, essentially? We can continue to exert more closures on groups congregating. Right now we're calling upon private businesses who have an essential function in our community to please exercise the recommendations of the CDC. So do proper disinfection and social distancing within the workplace and that sort of thing. And I hope we never get to the point where we need to ratchet down on that, because the essential businesses are that. But I could see metering how many people come into a grocery store, for instance, at a time, and that would be simple to enact, and some communities are already doing that. And some workplaces extending their shifts, maybe having shifts where they don't, so that they don't have as many people working close together. In City Hall, we will continue to work, but we don't have to get out of our chair and go talk to somebody. If we need information from a coworker, we can pick up the phone and call, and even limit our interactions with our coworkers. All of those efforts will help. And I think there's an infinite number of other ways that we can continue if necessary.
How important is it to keep the manufacturing businesses in town working and operating? Because it's my understanding they're not going to be impacted by the action the council took just a little bit ago.
Right, he asked how important it is to keep the manufacturing businesses operating, and it's very critically important. Some of them have already been deemed essential by the federal government, and so they have to keep producing what they're doing. And the businesses that we have here locally are the heartbeat of our economic health, so we want them to continue operating as much as they can. And they are more essential than the entertainment and that sort of thing. So we're going to start this way and see where that leads us. And hopefully we won't have to take more draconian measures in the future, but if we have to, we will.
And then one question for Shannon, if I could, please. I know, Shannon, you represent Prairie Lakes Healthcare. In a situation like this, we have other healthcare providers in town, Brown Clinic, we have an independent clinic. Do you, during times like this, when we're going down this path, do you communicate? If it were to come to it, you could share resources, materials, providers, doctors, if it got into a real extreme situation? Or do you kind of just all work independently when something like this happens?
Absolutely, we're working together. Even when this started last week, with the city task force, every medical community is represented at the task force. We've had great communications back and forth. We've had to get some supplies already from one of the other medical providers in town, and they've been more than willing to share. We've done some training for their staff for things. Everybody has been working very cohesively for the better of Watertown and our community. Again, in the surge plan, if something would happen, all of those players are at the table. When the plan was written 10 years ago, there were a couple of the medical providers that weren't up and running at that time, and they've been brought into the plan and figured out how we're going to provide the best care for our patients for our community so that we can keep functioning at the level we do, because we still have to continue to take our inpatients and have emergency surgeries, and heart attacks are still going to happen, and traumas are still going to happen, and broken bones, and people are going to need to be seen for other things other than COVID. And we're going to, we've got lots of plans in place to keep running as smoothly as we can. Lots of plans, a lot of talking is going on all the time. A lot of meetings are happening to be able to make sure that we can keep our medical staff, providers, everybody running smoothly the best that we can as information comes up.
You had a release late last week that any elective procedures would be postponed during this. What would some common elective type procedures be that people in this community might be scheduled to have that they're putting off for the time being?
Yeah, that's a very good question. I did not get a visit with the physicians about that, but we're looking like colonoscopies have been rescheduled. They're important to have your screenings done, but at this time your screening can be put out so that we're not bringing you into the facility. Yeah, we're gonna have Jennifer come. She knows a little bit more about what procedures have been postponed at this time.
That was a good question. So everyone who has a procedure currently scheduled is being contacted directly. So it's really up to that provider in looking at that patient's condition and determining it on a per patient basis, because everyone's health and wellness is very personal. So it's looking at what's going on in that person's life, because a colonoscopy for me may be elective, but a colonoscopy for someone else may not be because they have other things going on. So it's really on a per patient basis that they're determining that and then contacting that patient directly. Perfect. Yes.
I was wondering if we could get more information about like the demographics of the patient who has tested positive, or more importantly, have they been out in the community? Have other people been exposed to them, and have they been contacted about that?
Sure. So the patient was contacted by the Department of Health, and the Department of Health she asked a question about the positive patient in our community, Cottington County, and that person was contacted by the Department of Health, and the Department of Health really leads that investigation and that discussion with the patient, and that's all we are privy to say because of privacy laws. That patient has been contacted by them, and they are working through that process with the questionnaire.
Okay.
Yeah.
Is there a danger of community spread at this point? Do they know that, or can we know that?
So the governor talked a little bit about community spread this morning, and as of right now in South Dakota, the only region she thinks there may be community spread is in Beetle County. Any other questions?
Question. Do we know how many tests have been submitted to the state health lab from Cottington County from our area? And how many tests are pending? Do we know?
Okay, so the question was how many tests have been submitted from Cottington County and how many are pending, how many are positive. We have no way of knowing how many have been submitted. All we can see is the same information that everybody else can see on the South Dakota Department of Health website. And so we can see pending, and then it will break down when there is a positive what county it belongs to. So this morning we did receive the news that Cottington County has one. But I wish I could give you a better answer, but we don't know.
All right. Thank you for joining us today, everyone in the room for social distancing and everyone online for watching live.